Hello, I'm urologist Omer Makaya. Today we will evaluate the most common testicular pains. Testicular pain is unfortunately common. It can appear at any age, in young people and adults. Testicular pain is one of the most common complaints, especially in young people. It can sometimes occur in the elderly. We will evaluate the most common causes today. The most common cause is infection. It can be an infection that we call inflammation of the gonads, or inflammation of the epididymis. It can also be an infection called ovarian infection. Sometimes patients come in after reading about it on the internet and say that they have orchitis or epididymitis. As you can see here, we call the epididymis, which surrounds this upper region, that is, this area over which the sperm travel. We call this area the ovarian testicle. There is redness in this area, redness and swelling of the scrotum, and this is very obvious and causes a very severe pain when you have inflammation of the epididymis. That pain does not go away after a few hours. When you touch it, it causes very severe pain. The patient must receive a treatment and must be seen by a urologist. Apart from that, ovarian inflammation can sometimes be caused by inguinal hernias. Because this is the area we call the cord coming out of our testicle, passing through the hernia canal. In other words, if that hernia canal expands, if the fat or intestines in the abdomen start to strain it, or if the person lifts heavy, or has a heavy job, there may be inflammation due to a sudden increase in pressure in that area. So it can also occur due to hernias. Apart from that, if we look at the reasons you rarely see, we see testicular torsion, which can happen in young people, usually under 30, but it is very, very rare. Here we can see that the testicular cord is rotating around itself in this way and the blood supply to the testicle has stopped. But this is something that happens very rarely, very rarely. It is a very dangerous situation, especially in children. We see that testicular torsion is a condition that progresses up to testicular loss. Besides that, there are testicular tumors, my friends. In other words, in a patient who comes to us with scrotum pain, we definitely have a testicular ultrasound done even if the physical examination is normal. In the testicular ultrasound, we can actually diagnose the patient with a testicular tumor, sometimes by coincidence or due to pain. This is important, of course. This should not be overlooked. It can be missed in physical examination. But it is usually caught on ultrasound and does not escape. Apart from that, of course, there are traumas and blows directly to the testicle. Or the patient, for example, let's say he went to play a football game and forced himself too much on the field. He might have strained his groin muscles. There may be pain reflected in the testicles due to excessive strain of the muscles in that area. Apart from that, one of the most common causes is varicocele. In other words, enlargement of the veins leading to the testicle. As you can see here, this is a very classic image. As you can see, the veins thicken and the blood flow in the veins slows down and swells. It's like varicose veins on the leg, which look like folds. Or it can be like hemorrhoids in the rectum, a disease of the veins, which can cause testicular pain. Patients may sometimes present to the emergency department for this reason. Here again, physical examination should be performed and the necessary treatment should be given. But it is absolutely necessary to say clearly that it is difficult to detect anything in physical examination and ultrasound in most patients with testicular pain. So we can say that half the time the cause cannot be identified. The important thing is there orchitis? Is there a varicocele? Is there a testicular tumor? Is there a vital problem with the patient's testicle? No organ loss, no tumors, no infections. Biz bunlari uzman aldugumas isen irdidioras. If the patient has no pathology, we can follow the patient with painkillers and antibiotics. Very, very rarely, chronic testicular pain can occur. Those patients are also treated in some way. That was the summary of testicular pain. Thank you for listening. Best regards.